Hi everyone. Today we will be briefly discussing the theory of self-care on chronic illness. You can see the objectives for this lecture here. Our goal is to describe the theory of self-care on chronic illness and to discuss how to best apply this theory to the care of heart failure patients. The theory of self-care on chronic illness addresses three major concepts that we will dive into later on in this lecture. They are self-care maintenance, self-care monitoring, and self-care management. The population we will apply this theory to is adults aged 65 years or older living with congestive heart failure who are managed by outpatient primary care practices. 26 million people around the world are affected by heart failure, with a total expenditure of over $31 billion annually. The lifetime risk of developing CHF at 40 years old in the U.S. is 1 in 5. CHF is often accompanied by numerous comorbidities, including hypertension, dyslipidemia, obesity, and diabetes. By 2030, a staggering 8 million people in the U.S. alone are anticipated to receive a heart failure diagnosis, a shocking 46% increase. However, more readily available CHF treatment options will increase the prevalence of Americans living with this disease. As the U.S. population continues to age, more people are diagnosed with CHF, leading to increased healthcare spending. A projected increase of 127% in healthcare spending for CHF is expected from 2012 to 2030. So why does this matter? Why should nurses strive to solve this problem? Well, 95% of care for chronic illnesses, like CHF, is performed by either patients or their families at home, not healthcare providers or acute care facilities. Nurses can encourage and provide the proper resources to care for these illnesses at home. In order to improve care for chronic illnesses, adequate patient and family health literacy and education is necessary. However, nearly 36% of adults in the U.S. are considered to have low health literacy. Nurses can provide education and strive to increase patients' health literacy, aiding in successful self-care. The middle-range theory of self-care on chronic illness was actually developed in caring for heart failure patients. This theory was largely influenced by Orum's grand theory of self-care. However, this theory focuses on self-care in chronic illness and the process of self-care rather than specific activities such as meditation. Barbara Riegel understood that patients with chronic illnesses, such as heart failure, struggle to care for themselves as their illness often dictates how they live. This theory defines self-care as a process of maintaining health through health-promoting practices and managing illness. This process is suggested to be utilized in all states of health, both ill and healthy states. So digging into those three major concepts of the theory we briefly touched on before, self-care maintenance includes behaviors that improve well-being, preserve healthy and/or maintain physical and emotional stability, such as smoking cessation, preparing healthy food, coping with stress, and taking medications as prescribed. It is a collaborative process with the patient, family members, and healthcare team. Adherence is essential, and a strong commitment must be made for adequate self-care maintenance. Self-care monitoring includes routine vigilant monitoring of oneself for changes in symptoms. For example, someone monitoring their weight for fluid overload and heart failure. It's referred to what's known as body listening. The goal is to recognize when these changes occur. Self-care monitoring is the link between maintenance and management. Self-care management is the response to these signs and symptoms as they occur. Management also requires attention given to the effectiveness of different treatments as they're tried. Situational awareness involves alertness to bodily sensations and the ability to determine how these sensations change in response to the treatments implemented. It's important to recognize that there are potential barriers to self-care, especially depending on the patient's state of health, age, functional and cognitive abilities, and access to care. Some patients develop great self-care habits and incorporate these practices into everyday life. However, others view self-care as a chore or as work in which adherence and motivation often become a problem. Care partners and the healthcare team should be supportive and involved in this process, encouraging self-care as much as possible. This graphic is a great overall visual representation of those three major concepts. Again, it is important to recognize some of those factors that may affect self-care, like motivation and access to care. Maintenance can include health-promoting practices such as physical activity, adequate sleep, nutrition, and treatment adherence. Monitoring is the process of awareness, recognition, and interpretation of symptoms, such as activity restriction, stress, and pain. Management is the response to those symptoms as they occur. Most importantly, the positive outcomes of self-care are listed on the right-hand side. Self-care can lead to improved well-being and quality of life, increased perceived control of the patient's illness, in addition to reduced symptom burden and ultimately reduced mortality. Now, we can apply this middle range theory to heart failure in a stepwise fashion. Good symptom monitoring leads to good recognition of new symptoms or changes in health status. By recognizing and evaluating changes, the patient is able to receive treatment in a more timely manner and implement new strategies earlier. Finally, the theory of self-care and chronic illness contains 7 testable predictions as pictured here. There are similarities in self-care across different chronic illnesses. Self-care monitoring is needed by all patients with cancer, heart disease, and diabetes, for example. Previous personal experience with illness or in caring for somebody with a similar illness can increase the quality of self-care performed. Patients who engage in self-care that is adequate but unreflective are limited in their ability to master self-care in complex situations. Those who do not reflect on what they have learned have difficulty achieving a high level of mastery. Misunderstandings, misconceptions, and lack of knowledge can all contribute to insufficient self-care. Mastery of maintenance must occur before mastery of management for adequate self-care, and monitoring for changes in signs and symptoms is necessary for effective management, simply because one cannot make a decision about a change unless it's been noticed and evaluated. And as always, evidence-based self-care is going to be more effective than non-evidence-based self-care. So in clinical practice, this theory can be used as a way to determine where in the self-care process a particular patient is struggling. For example, someone who's unable to recognize symptoms will need a very different intervention than someone who is poor in self-care maintenance. We as advanced practice providers will be able to structure our care and recommendations in a more personalized way as we utilize the theory of self-care on chronic illness. Thanks for listening. Be sure to check out the resources used in this lecture for more information.